When I was a child, I was dreaming to become a doctor and to treat the people and save their life. And with this dream, I graduated in the secondary school, and then after 6 years, I finished the medical academy and decided to go to the narrow specialty as a dermatovenerologist, which means to deal with skin diseases and sexually transmitted infections. So there was several advantages of being in this specialty, because patients never die and they're chronic disease and they will always come to see you. During 2 years' time, I was really enjoying the practicing as a resident student in the clinic. But then when I finished, I was hired as a doctor, but for 50% of occupation, the position, and the salary was even not sufficient for my transportation cost from home to the hospital and back. So that situation was somehow really disappointing me at that situation. I start to check how the other doctors are living there, who works there for many years. And they just open a secret that if you want to survive and if the government is not really acknowledging your work, then you take it from the patient because it's your work, you are providing service. And on top of that, the sexually transmitted infections are likely to be anonymous. And for that, you get even bigger topping ups for your salaries. And this fact was kind of really something like breaking in my mind. Mentally, I was not really ready to get the money from the patients for my job, because I was 100% sure that all the doctors are such an ethical profession that you can never expect there any extra money from the patients. Maximum maybe flowers or maybe chocolate to thank you. But then when I realized that in order to survive in my life, in my profession, I have to just ask every time money from them, that was really drive me to the depression. Almost 1 year I was really hardly can work, really couldn't sleep. It was really the very difficult time which I spent. And then somehow I got the invitation to make some short-term job for one of the project of the international organization. And since then, I just decided that it's better for me to go there and earn money with my real job without cheating or lying to my patients. That was the way how I lived the practice.